Hi, Dr. YASS here. For almost 40 years, you have had the medical establishment as the primary means of addressing your pain and other symptoms. You have given them 40 years to get to the point to where you should be seeing a reduction in the number of people suffering from chronic pain, the intensity of pain reducing, the length of time that people have pain reduce, and yet there has not been any reduction in any of those categories. They have had almost 40 years to recognize that the use of the MRI is baseless. So I want it made clear that it doesn't really matter what medical specialty you enter. If you think you went to a neurologist and it failed, so going to an orthopedist is the answer, or going to a chiropractor, a physical therapist, a rheumatologist, a pain management doctor. The reality is that the entire medical system has failed. Then you ended up having offshoots of it. People kind of in the medical field, but somehow promoting something different, and that has failed. So there needs to be a new beginning, a renaissance, a way of going to the core of the question of what chronic pain is, how to identify its cause, and how to resolve the cause. And that is what the YASS method is. It is a diagnostic and treatment model. Now, I'm doing this video for a guy who I have been treating for just a couple of months now, who happens to be in Canada, and he has had pain for 6 years. The last year, he ended up being almost a recluse because he could not function, and he had tried every type of treatment, and it all failed. He found me. I was able to identify the cause of his pain as being related to a muscular deficit, and it was able to be seen in his posture and other types of corroborating symptoms that the pain was literally coming from the muscle. And he's substantially better. His life is transformed. He goes out of his house now. He's able to do so many more things. He doesn't have to question every single time he's going to make a move whether he's going to have pain. He was sleeping on a concrete floor. Now he sleeps in his bed. His life was transformed. And he began to tell me about the story of how he found me, and also why he thinks people might be hesitant in following through and trying to get the YASS method. And that's really what this video represents and I want to talk to. And his biggest point was the fact that I don't look very professional. If you Google me on the internet, I don't have a big presence. I don't have any major organizations or universities endorsing me. I don't have people around the globe utilizing the YASS method. And his position was that the appearance of me as a practitioner inhibits the ability of the person to actually look at the methodology that I employ. And that is a tremendous hesitant to them. It literally limits them from looking further into whether this method could help them. And so my point to anybody who comes across this video has to be to see if I answer the core questions that will help you eventually end your pain and resolve it and allow you to function normally. There literally is nobody else out there who is addressing these core issues. And without these core issues being identified and addressed, you don't get pain resolution. You don't get return of function. So you want to go to the very beginnings of questions to see whether what you're going to do will help. You could tell up front. I could tell you right now that the surgery you're going to get will not work because it's addressing a tissue that is not the tissue in distress eliciting your symptom. Therefore, any correction of the tissue that's being surgically repaired isn't going to change the fact that the tissue in distress continues to elicit pain, and therefore you continue to have pain. I mean, this is the kind of stuff that's just blatantly obvious. So you have to get into this and really understand what's going on here. So number one, you have to look at what is pain, number one. And so what is pain? Pain is an indication of a tissue in distress, right? The body is eliciting the pain, or that tissue, in fact, is eliciting that pain as a way of creating conscious awareness of the distress of the tissue. It wants an intervention to resolve its distress, and once that distress is resolved, it no longer has to emit pain. So any treatment that addresses pain itself is completely worthless, will fail. You will never get to the point of which you don't have pain. Epidural nerve blocks, cortisone shots, radiofrequency ablation, rhizotomy, any kind of pharmaceutical thing, cold laser, any prayer. I don't really care what someone's promoting to you. If it's specifically designed to resolve pain or address the actual symptom of pain, you will fail. Okay, so that ends that grouping. Okay, so we now know that pain is an indication of a tissue in distress. We have to go on to the next question. How do we identify the tissue? And the global position is the MRI. Well, the MRI just finds structural variations that exist. And since you happen to be having pain at the time that the structural variation is identified, that then is asserted to be the cause. But that's just absolute bullshit. And it's based on bullshit. It's based on junk science. The phrase junk science is not something to just be bantered around. It relates to a specific type of science known as correlative theory, which is the attempt to say that since something happens at the time of something else, it is the cause. And it can be easily disputed by saying, well, the MRI would find that you have two elbows. Clearly you have two elbows. So why can't we say that two elbows is the cause of your pain? Because it was found at the time you're having your pain. That's how perverse this is, how foolish this is. Then you have to look at the fact that as many people with no pain have the same structural variations in the same percentages. So clearly, this is just a baseless method. The results of surgeries on structural variations failed miserably. So you have to understand that just at this point, that the attempt to identify the tissue in distress, the one eliciting your pain, the one that's going to have to be resolved so that the pain stops, it will never be identified by a diagnostic test like MRI, X-ray, EMG, none of it. None of it. So that eliminates basically the entire medical system and most of the extraneous methods that are supposedly treating something. So we've knocked out almost everything by looking at two potential things. Understanding what is pain and understanding what's the proper way of identifying it. The MRI is wrong, so what's right? Well, the YASS method mechanism of interpreting the symptoms you're experiencing. Not just the pain itself, but are there other indicators? Do you have an altered posture? Do you have an altered ability to move? If you press in a spot, can you identify what tissue that is? There's multiple ways of looking at it, and that's the whole idea of the YASS method means of diagnosing. It is to interpret the body's presentation of symptoms, those very symptoms being elicited by the tissue in distress. So if you could interpret the symptoms, you could interpret the tissue. And you must understand that every tissue creates a very specific set of symptoms. You know that because you know that a heart attack is indicated by pain at the chest and the left arm. A complete loss of strength or sensation at one side of your body indicates something wrong with the brain, right? You've got the connection. You just don't know it when it comes to pain, but that is exactly the connection. The pain is coming from the tissue in distress along with other types of symptoms. You need to interpret that. That's it. That's it. How do you not see that as the purest way of understanding what's causing your pain? How could you not see that? You now know what pain is. You now know how to identify it. Tissue in distress, symptoms being elicited. Interpret the symptoms, identifies the tissue. Now, it just so happens that it turns out that in more than 98% of cases, the cause is muscular. So you then have to say, okay, well, this guy's saying it's muscular. Nobody else is saying it's muscular. Right? How come he's saying it's muscular? Because you have to recognize that chronic pain only began about in the 1980s going forward. It never existed prior, and certainly not across the expanse of ages of people suffering. Pain was always something associated with older people, right? People after they retired. But now you have people in their 20s all the way up to the hundreds suffering from chronic pain. Why? And the answer is technology. Technology led to a lack of use of muscle, which now makes the muscle more susceptible to straining when the forces of gravity, which must be pushed against to perform activity, are pushed against with a force output of muscle that's less than the force requirement of the activity. That's why that's why everyone's eliciting pain. That's why you associate your pain with activity. If any of this sounds like I'm talking to you, and that's what this guy said. The guy said he was able to get through all the other aspects of what seems wrong about this. Why do I get 40 views on my videos, not 400,000 views? Why do I have 500 subscribers, not 10,000 or 100 billion subscribers? And the answer is because I am a singular individual who happens to have come up with the answer to why pain exists and how to resolve it. But don't be deceived that this is where this ends, because in the next year, you will see those numbers rise. You will see practitioners available beyond me. You will see a greater presence on the internet. So let's put all that aside and really let's just think about the fact that you're just like this guy who's living in his house, in his room, who can't get off the floor, who can't sit for 2 or 3 minutes, who can't go out and visit his friends, who can't work, who can't go to school, who can't have a relationship with anybody, who has difficulty eating, sitting long enough to eat, all because they're having chronic pain. And you're worried about the fact that I don't have a big internet presence or that I don't have lots of views? When you listen to what I say and it is pure in its position as to what pain is, how to identify it, and how to treat it? If that's you, I wish you luck. I hope someday you find an end to your pain. But if you're a person who's seeking the true, pure understanding of how to diagnose and treat your pain, and you get a chance to hear this, I suggest you take that chance. Contact me, and let's move forward in getting you the proper diagnosis, the proper treatment. If in fact you fall into the 98 to 99% of those suffering with chronic pain who happens to have a muscular cause, all you need to do, just like this fellow, is be guided in understanding which muscles are responsible for your pain and how to perform the correct progressive resistance exercise. Not exercise, not calisthenics. That eliminates the rest of the freaking planet. Those people are saying that they know how to exercise you to get you out of pain. If you are not causing a muscle to adapt to a greater and greater resistance, there is no way the muscle will get stronger, period. I don't care about calisthenics. I don't want to hear about anything else. I don't want to hear about doing lots of sets, lots of reps. None of that matters. There's only one way to make a muscle get strong, and that's to cause it to adapt to a greater and greater resistance. There's a linear relationship between strength and mass. Increase the strength of the muscle, you increase the mass of the muscle, you increase the functional capacity of the muscle. Get the force output of the muscle greater than the force requirement of your activities, you are pain-free and fully functional. In 4 weeks, this guy will tell you his life has been transformed. Transformed. I could only imagine how scary it is that he will tell me that every thought he had came down to one thought. If I move this way, will I get pain? If that's you, you don't have to be that way anymore. This guy basically became a recluse at 21 years old. If that's you, you don't have to be that way anymore. I half-jokingly describe this as the next coming of pain resolution. But the reality is that this is the only legitimate way to diagnose and treat your pain. So it's your time. It's your chance now. The new year's coming. Make your decision. If gloss and glitz is the answer, go everywhere else. If you want pure science based on absolute logic, which has been reaffirmed by nearly 3 decades of treating people, then this is your path. That's the story, okay? So if you like the video and it makes sense to you, please give it a thumbs up. If you like my YouTube channel, Dr. Mitchell YASS, please subscribe so you can get more videos like this. Get notifications when these videos are coming out or when I'm live on YouTube. If you want to get in touch with me, maybe you're having a question, maybe this has stirred some understanding and some interest and you want to contact me about your issue, contact me at drmitch at mitchellyass.com, DRMITCH at MITCHELLYASS.com, drmitch at mitchellyass.com. Okay? If you want to get a Skype session or a Zoom session, now you do believe that this is your path and you can be helped, we can do a Skype or Zoom session for you anywhere in the world. I've been doing this for 5-6 years now. Skype and Zoom sessions all over the world to help people get the chance to actually end their pain and live pain-free. So that's the story. I wish you the best of New Year's. I wish you a pain-free, fully functional life. I wish you the gift of knowledge that will help you get beyond your pain and allow you to live the life you so justly deserve. For now, Dr. Mitchell YASS wishing you a pain-free, fully functional life. Bye-bye for now.